Welcome to Dr. Martin Health Tips, your trusted source for simple, science-backed ways to protect your health, extend your life, and feel your best at any age. Let's dive into today's important topic. Seniors, if you take vitamin B12 every morning, you need to hear this carefully. Right now, while you're sitting comfortably, maybe sipping your morning tea or coffee, something could be happening silently inside your body. No pain, no dizziness, no warning signs that would make you stop what you're doing or call your doctor. And yet, beneath the surface, a process may be quietly increasing your risk of stroke and heart disease. What makes this especially concerning is that it often happens in people who are doing everything right, taking their medications, following their doctor's advice, and supplementing with vitamins like B12 to stay healthy. But here's the truth that many people don't realize. Vitamin B12, when combined with certain common medications, can create unintended consequences inside the body, especially after the age of 60. Today, we're going to break this down clearly and carefully. Which medications may interact with B12, what's actually happening inside your body, why a hidden marker called homocysteine matters, and most importantly, how to protect yourself. Why this matters more. After 60, as we age, our bodies change in ways that aren't always obvious. Nutrient absorption becomes less efficient, the stomach produces less acid, the digestive system slows down. Because of this, many seniors are advised to take supplements, and B12 is often at the top of that list. And for good reason. Vitamin B12 is essential for nerve function, red blood cell production, brain health energy levels. A deficiency can lead to fatigue, memory problems, nerve damage, and even anemia. So naturally, many people think, if some B12 is good, more must be better. But that's not always true. The hidden risk, when B12 meets certain medications. Let's talk about the two most common types of medications involved. 1. Metformin, for type 2 diabetes. Millions of people take metformin daily to control blood sugar. It's effective and widely prescribed. However, over time, metformin can interfere with the body's ability to absorb vitamin B12 properly. Here's how. Your body needs something called intrinsic factor, a protein produced in the stomach, to absorb B12. Think of intrinsic factor as a delivery system. Without it, B12 can't reach where it needs to go. Metformin can disrupt this system over time. So what happens? B12 from food isn't absorbed well. Blood levels may appear low. Doctors often recommend supplements. That sounds logical, but here's where things get complicated. 2. Proton pump inhibitors, PPIs. These are medications used for acid reflux, heartburn ulcers. Examples include drugs like omeprazole and pantoprazole. They work by reducing stomach acid, but stomach acid is essential for releasing B12 from food. Without enough acid, B12 absorption drops. Deficiency risk increases. Supplements are often recommended. Again, this seems reasonable, but it can create an imbalance in some cases. The real issue, homocysteine. Now we come to the most important part of this discussion. Inside your body is a substance called homocysteine. In small amounts, it's harmless. Your body normally uses B vitamins, especially B12, B6, and folate, to convert homocysteine into something useful. But when this system doesn't work properly, homocysteine levels rise, and that's where the danger begins. Why elevated homocysteine is a problem. High homocysteine levels have been associated with damage to blood vessel walls, increased inflammation, greater risk of plaque buildup, reduced elasticity of arteries. Over time, this can contribute to stroke, heart disease, circulatory problems. And here's the key issue. Homocysteine is not routinely tested in standard blood work. So many people may have elevated levels and not even know it. What about B12 supplements? Here's where things can get confusing. B12 is supposed to help lower homocysteine, but in certain situations, especially when absorption is impaired, the body isn't processing B12 efficiently, or doses are excessively high, the system may not work as expected. This doesn't mean B12 is harmful, it means how your body processes it matters. Common misunderstandings. Let's clear up a few important points. B12 itself is not dangerous. Supplements are not inherently harmful. Medications like metformin and PPIs are not bad. The issue is interaction and imbalance, not one single factor. What you can do to protect yourself. Here's a practical, balanced approach. 1. Review your medications. If you're taking diabetes medication, like metformin, acid-reducing medication, PPIs, it's worth discussing B12 with your doctor. 2. Ask about testing. Consider asking your healthcare provider about vitamin B12 levels, homocysteine levels, folate levels. This gives a clearer picture of what's happening inside your body. 3. Be mindful of dosage. More isn't always better. Many supplements contain very high doses, sometimes far more than your body needs daily. A healthcare professional can help determine the right amount for you. 4. Focus on balance. The body works best when nutrients are in balance. B12 works together with vitamin B6 folate. Supporting the entire system is more effective than focusing on one nutrient alone. 5. Don't make sudden changes alone. Never stop medications or change supplements abruptly without medical guidance. Your treatment plan should always be personalized. A realistic perspective. It's easy to feel alarmed when hearing about potential risks, but it's important to stay grounded. Millions of people take B12 safely. Millions take metformin and PPIs safely. The goal is not fear, it's awareness. Final thoughts. Your health is not determined by one vitamin, one medication, or one test. It's the result of how everything works together over time. The most powerful thing you can do is stay informed, ask questions, and work closely with your healthcare provider. If this information helped you understand something new about your health, consider sharing it with someone who might benefit, especially someone over 60. And don't forget, stay informed, stay proactive, stay healthy. This is Dr. Martin Health Tips, helping you live longer, stronger, and smarter every single day.